Hi, this is Christine Delanzo, and I'm with an amazing psychotherapist, a somatic psychotherapist. Am I saying that right?
You are saying that right.
What is that?
So, somatic, probably the easiest way to think about it is that it just really means body based.
Body based.
Yeah.
So when you're doing therapy, you're literally like looking at your whole client's body as they're processing and things like that.
Yeah, so some people actually believe that the body is like the right brain is sort of the body in a way, right? It's like that intuitive channel that we house all of that in our cells and in how we're organized unconsciously in the body, that we're sort of playing out that realm of things, right? The non-linear. And also, like the body, we hear the cliche, the body doesn't lie, right? And there's truth in that. Like the body is like a storehouse for all of the imprints of what we experience. It's like the cells sort of absorb those experiences in a way, and we take on certain holding patterns and certain ways of being and certain almost character strategies, if you will, that get into how we habitually move and hold ourselves and orient. So we're starting to bring awareness to those ways of being that we're not always conscious of.
Yeah.
It's like you can only solve a problem with the same level of consciousness that created it, right? I'm paraphrasing Einstein. But we can only sort of use our left brain so much, and so we have to go in through a different avenue.
Yeah, it's fascinating. For our profession, we're just hairdressers, and oftentimes we're doing people's hair and they're processing in our chair, and we become therapists, but we have no training, none whatsoever. And so I guess my question for you is, as a therapist, like if you could give us some sort of insight as to, how to handle it, like what to know, what to do, or you start to notice things in your own clients' bodies or what they're doing, and we're not even sure. We're just trying to do the art. So any sort of insight that you could give us.
Yeah, so I'm struck because knowing you, right, you have a sensitivity. You're able to pick up where people are vulnerable, and you're able to, what in our language for that is track. You're able to track where someone is having shallow breath, or where someone is sort of agitated, or you feel like they're on edge, and there are markers for those things, right? Like the breath is one, fidgetiness. There's these things that we start to see that are indicators that someone is a little maybe ill at ease. And so one of the things that we do in at least some schools of body psychotherapy is we use touch. And touch, as the saying goes, one touch is worth 10,000 words, right? So
I like that.
You are touching people all day, right? You're doing hair, and you have your hands in, as you say, this very vulnerable place in a way, right?
Yeah.
It's connected to the crown, and I love your metaphor of the hair being like sort of the antenna, right? So you're in that kind of space with people. But even just as we were prepping for this, and you were sort of doing this, it's like, right, there's this sense of,
it
like,
feels so good,
right?
when
It's
people
almost
touch
a little
us.
bit like of a trance kind of quality, and then what happens is you notice the nervous system begins to get quiet.
Yeah.
And so just being aware, right, that even just like laying a hand on someone gently, and how you move in and out of someone's space has a lot to do with it too. Like, you don't want to be jarring, and you don't want to be quick, and you don't want to be waving the scissors in somebody's space, right? You want to be sort of mindful in your movement and in the way that you attune. That would be another kind of some of our language. We're attuning. There's like a limbic resonance, right? Limbic resonance is kind of like that phenomenon where when a mother holds a baby up to her heart, that the heartbeats naturally sync up, right? In that kind of attunement process. And so there's something when you're in people's physical space that way, and you're touching, or even if you're not touching, you just could be energetic, you're close. There's a way that attunement process is naturally going to happen. But if you're chaotic and you're unregulated,
yes,
obviously that transfers.
Yeah.
So something about just the way that you're aware of your, yourself and your own sort of centeredness and being able to orient to people from that place and knowing how much impact that has.
Yes. Well, when you talk about your own centeredness, do you have like some sort of a technique that you like to use for just like centering yourself?
Well, I'm a meditator. I mean, that's the biggest piece. And so that's a regular practice, and you do some of that.
Yeah.
You're also yoga.
Yeah.
And I do a lot of, I also do a lot of energy healing, so I do self Reiki every night.
Oh.
And or morning, depends. But I
Yeah.
do a lot of just kind of putting my hands on myself and really sort of giving myself energy. And it's a simple practice in a way, but profound, and you don't have to be formally attuned to
Right.
the energy to give back kind of energy to yourself.
Yeah.
And
So it makes me think, like, in between clients, sometimes if we have a really difficult client, and how do we sort of clear our own space? That just fascinates me when you say you lay your hands on yourself, because maybe we could sit in our own chair and maybe just put our hands like on our heart, or just some sort of exercise to make us feel grounded. Do you have a suggestion for that? What would be good for that for us?
well, I think that's great. Giving yourself back your own energy, right?
Yeah.
And just some sort of, I think of intention as being sort of the thing that fuels any process. So if you want to sit with yourself for a minute or 5 minutes in between clients, and your intention is to kind of take back your own energy and to let go of whatever doesn't belong to you, that even in whatever way you're articulating that, sort of in yourself, and with the help perhaps of your own hands, that just that intention alone and some breathing and some self-contact is good, especially if you only have a couple minutes.
Yes. Oftentimes we have like the time that it takes for just someone to be getting shampooed, which could be anywhere from 5 to 10 minutes, depending if they're having color removed. And using that time, especially if you're a really busy stylist and you're seeing, 8 to 10 people, and it's constantly they're moving in and out, to be able to take that time and maybe just sit in your own chair, close your eyes for a minute, tap into your own breath, and just a few deep breaths in through your nose and out through your nose, and holding that intention, like, I'm going to restore myself. That would be so nice to do. I've never thought of doing that. Usually I just close my eyes, sit in my chair, put my feet on the ground, and just sort of like say a prayer to just sort of clear the space for the next person. I'll spray like rose water in the air or something like that. But I really like the fact of you're putting your own hands on yourself. That means a lot. And I liked the way when you talk about just calming someone down. Like when people first come into our chair, some people have had hair trauma.
Sure.
Do you deal with anyone with hair trauma in here? Like,
I deal with anyone with hair trauma. Gosh, over the years, have I? I don't know if hair trauma specifically, but certainly people who have, different body traumas, or, so I can sort of appreciate it from that perspective, although I don't know if specifically hair trauma has come into
well, for us, if someone has hair trauma, it'll present like really fidgety, really they're nervous. Sometimes they're sweating a little bit. They'll be shifting back and forth in their chair. Their weight's a little bit off, and just by like taking your hand and just sort of laying it like on their shoulder, just like this, or just starting to like touch their hair really slowly and gently, and making that eye contact with them really helps that client with that trauma just sort of settle down. And one of the things I love that you do is you're really good with voice control. Like you really, like when you're trying to settle everyone down, you're really slow in yourself, and that transfers. I know it transfers to me, and I think that it transfers to people, and being aware of how we transfer like that is important.
Yeah, I think you're coming back to sort of that piece before about kind of asking how you are translates to the client. If you're chaotic,
Yeah.
and sometimes the voice, we can be frenetic. I mean, I can do that too. I can be like, rah, rah, rah,
Right.
In other spaces, not so much this space, because we're wanting to be, there's something about kind of being slower and more grounded that just invites people to be more in that receptive space. So I think absolutely.
Yeah.
It's a great
So if you had like one piece of advice to give us hairdressers, what would it be? Just out of all your years of experience and just...
Well, I mean, I don't know so much of this as advice, but I think the one thing that's kind of coming to me is just that you guys are healers, right? Like you do aesthetic work, but you do healing work, and and I'm like someone who very much sort of believes in the both and there. I mean, I'm more like in the healing realm, but it's really important to me. I almost hesitate to say beauty because it seems I have this moment of judging myself like that's superficial, but it's like, no, there's something about the way you attend at that level that is, it's so not superficial. It's so it's just
sacred.
generative. It's sacred.
It's like sacred service. Like
yeah.
I mean, I think when anyone lets you close to them and in their space, that says a lot right there. Not to mention that you're coming at them with razors or scissors or chemicals, so they're really trusting you, and just being aware and mindful of what's happening in their body will give you a good clue as to if they're relaxed or they're not relaxed, and then how to just gently touch them and make eye contact with them and just hold that sacred space. I think that's really good.
Yeah, and that devotion. You keep using the word sacred, and it's striking me as like, you have a devotion to this way of attending to people.
Yeah.
That's it may be even more healing sometimes than what we do in this clinical realm of things, or it can be as healing, certainly as important to to be in that kind of space with people.
Yeah. Thank you.
Yeah.
Thank
You're
you
very
so
welcome.
much. Namaste.
Namaste.